Now I'm going to take you through an objective assessment for the lower back. Now we're going to split this into different sections. The first part of the objective assessment for the lower back is just to get a feel for how you move generally and what you can do, what you can't do, what might be sore, what might not be sore. So we're going to start with some simple movement patterns like some squats, some single leg squats if we can. And these will give us an idea of what your function is, pain or pain-free, and also just give us an idea for your general movement, but also where you might be weak, where you might be strong, where you might be stiff, where you might be tight. So we are going to use our lovely assistant Sarah here, and she is going to take us through the first part of our lower back objective assessment. Now the first thing I like to do with everyone I see, whether it's a back or lower limb injury, is just get them doing a squat. It's a simple functional movement that we do every day. We have to sit on the toilet, we have to sit on the train, we have to sit at our desks and get back up. So firstly, we'll just go for a normal squat, facing the camera please. And things that we're looking for here is, can we get full movement? Are we arching or flexing in the back? Are our knees dropping inwards so that we might have weak glutes there? Are we tight in the calf so our knees don't come over our toes? Are we stiff in the mid-back and we're collapsing through the middle? And we can get to do it with our arms above our head as well. So an overhead squat's lovely for this. We can see a bit tight in the mid-back there as the arms come down. And then the second thing we'll do is we'll have a look at a squat on one leg, because this is really nice for glute strength. You can pop your arms down. So we're going to stand on our right leg and do a single leg squat. Now again here we're looking at, have we got stability around the hip and pelvis? Because if we haven't around there, then they're not supporting the lower back as we might like them to. Is the knee dropping inwards? Are our glutes a bit weak there? Do you want to do the other leg? Can we keep the chest up? What's our core doing as we're going down through those movements? And also, can we just access the movement? Is it painful? Because again, we have to do this movement to climb stairs and get in and out of cars. So look at these two movements for everybody. Now, of course, not everybody could do a single leg squat. And if that's the case, we'll just look at what they like standing on one leg. So just standing on one leg. And again, have they got the balance? What's the torso doing? Is their core strong? Is their lower back strong? Are they dropping at the hip? Have they got weak glutes just on a single leg stance? And then of course we can progress that even more. So if this was all fine and we perhaps had a runner in front of us with lower back pain, then we could ask them to maybe do a step and land exercise, and we can look at how they go through that. So come off one leg and land on the other for me. Good. And again, you're looking at those similar sort of things that we're looking on the single leg squat. How do they land? Do they maintain body position? Do they collapse in? Can they keep their balance? Is everything functioning well? Are they getting any lower back pain on landing on one leg? Because there we can start building our hypothesis of what is the main pain driver. So we've got a good feel for how someone moves, how Sarah moves. Now we're going to look at specific lower back movements. Now, here we're going to look at forwards, backwards, side to side, and a few combined motions. So, Sarah, facing the camera, all I'm going to get you to do is keeping your back and legs straight. Can you bend forwards and touch your toes? Good. So here we're looking at how the lower back moves. Is it going for a normal pattern? Does it stay straight? Are we tight in the hamstrings? Can we get that far? And then most importantly, is there any pain when we do this movement? Because this will give us a real indication of what is causing the pain. So there are certain structures that cause pain when we go forwards, but not when we go backwards. And there's certain structures that cause pain when we go backwards, but not when we go forwards. So this gives us an idea of exactly what structure within the lower back is causing us pain. We might do that a few times to see if the pain builds or reduces, and then we'll go backwards as well. So if you can pop your hands on your backside and lean back for me as far as you can. And again, we're testing the structures in the back. This is particularly the facet joints, and we're kind of closing down those facet joints as we go. And again, is there any pain? How is the movement? Are we stiff in that lower back? And then we're going to look at side to side movement. So I get you just to reach one hand down one side And again, how far can we go? Is there any pain, tightness, stiffness? What are these muscles on the side of the back doing? Are they restricting the movement? Is the pain on the side we're going away from? That would indicate more muscular. Is the pain on the same side we're going to? That would indicate more jointy. And then we want to look at some combined movements. So then we're really closing down certain structures. So if you face that way for me, Sarah. So then we're going to get her to come backwards. And then we'll go off to the side. So shimmying over to the left as well. So we're really closing down those left-sided facet joints. And then we can come back up. Now often pain in that position will indicate a certain structure. We can also do that going forward. So if we get Sarah to bend fully forwards for me, reach down, and then walk your hands towards the right. So again, we're really stressing the left muscular structures in that lower back there. You can come up. So lots of movements that we can do that the lower back can produce that really gives us a good idea of, one, what structure is the main pain driver, which will help us to advise you on how to reduce that pain. But two, it gives us a real good idea of what we can do to help reduce the pain as well. If we know you're super painful going forwards, but not painful going backwards, we can work a lot of backwards movements to help the forwards movements. And then we can slowly grade those forward movements back to being normal and getting you back to your normal life. To complete the movement part of the assessment, we're going to look at the length of your hamstrings and length of your posterior chain and just see how the sciatic nerve is moving as well. So this is where I will get you to move around a little bit because we're going to need you to shimmy your phone or shimmy your laptop or iPad onto the floor, prop it up against the wall. You're going to lay down onto your back now. So we'll get Sarah to lay on her back for us. So laying flat there. Now what she's going to do, she's going to raise her left leg in the air, keeping it straight. So we're looking at length of that posterior chain. Have we got good hamstring length? Can we get that perpendicular to the hip? And we'll go down there. And then we'll check the other side. And then back down. And then we're going to test the sciatic nerve as well. So we'll get her to raise her left leg up. And then what we're going to do is get her to pull her toes towards her head there as well. And if we feel some tugging or increased pain through there, then we could have some tension in that sciatic nerve, which could also be causing us some problems. And you can see she loses a little bit of range there as well. So she has got some sciatic nerve tension. You can rest there. The third part of your objective assessment for your online physiotherapy assessment for your lower back is we're going to take you through some strength tests and some strength capacity tests. Now we have a whole battery of these which we will look at with you in different stages, but the first few that we use for the lower back mainly situates around testing how strong the glutes are, how strong the hamstrings are, and how strong the core is to give us an idea of what support structure the lower back has. So first thing we're going to do is get Sarah to do a glute bridge. So she's going to bend both legs up, arms across the chest, and lift the bum off the floor. Now if we're comfortable at doing this, we'll go for up to about 20 reps, make sure we're okay. We're looking good here. So now what we want to know is, can we do that on one leg? Because our glutes need to function on one leg to support the lower back through walking, climbing stairs, running, all those activities. So we'll lift one leg in the air and we'll do exactly the same exercise there. Now we're looking for stability of the hips. Does the other side drop down? Can we do the repetition? Is it causing us any pain? Good, and again, if that's good, we'll compare both sides and we'll go for high repetitions to see actually how much endurance do you have in those glutes to support that lower back. Second muscle we're going to look at is the hamstring. So we're going to get Sarah to bring her feet further down, come onto her heels and do the same exercise there. And you're going to feel this a lot more in the hamstrings. And again, up and down. And if we're able to do that, we'll then go on to the one leg. So if you raise one leg up for me, and then up. And again, same thing, we're looking to see, do the hips stay level, do they drop? can we do the exercise, how many times can we do it, how much endurance of the hamstrings do we have to support the lower back, and whether there is any pain. Third muscle we're going to look at is our glute med. So this is the muscle that sits on the side of our hips and provides that support when we're on one leg to stop us dropping in, which can obviously cause a lot of problems around the lower back. So we're going to get Sarah to lay on her left side. Now, with this, it's really important that we get the position right. We need the legs slightly behind the midline. So we're going to get Sarah to lift her leg and then bring it backwards for us there. Okay, so we need to be slightly back, so we need to feel it on the side of the hip. And then we're going to take it all the way down and all the way up, all the way down and all the way up. And again, we're looking to see, can we do the exercise? How many times can we do the exercise? So everyone should be able to do about 25 on each leg of these without getting too fatigued. And does it cause us any pain? Are we getting any real arching at the lower back? Is the lower back taking over to help out the glutes? If so, then there's some weakness there. Good. And then the final thing we're going to look at is the core strength. So we're looking at hamstrings and glutes and do they protect the lower back? And then really simply, if it's not too painful, we're going to look at a plank and a side plank to see where those things are. So we'll get Sarah to come up into the plank position. And we're looking, okay, are we nice and straight? Is there any arching at the lower back? Can we do it? Is there any pain? And then once that's completed, and again, we have some normative data, how much or how long should we be able to hold them for, which we can compare you to someone in your age category of what you should be able to do, or what they say you should be able to do, what the research says you should be able to do. And then we'll finish off with a side plank. And again, do we drop? Are we getting any pain? Any arching of the lower back? Any pain? And relax there. Good. So that's a simple sort of strength assessment. Now, you might not be able to do any of that because you're too painful. And we don't always complete that kind of full package of assessment because actually we might have all the information that we need from the movement assessment. And actually, we just need to get you moving better again before moving on to any of that stuff because we're working through different treatment and rehabilitation stages.